Back pain. It affects more than 80% of all Americans at some time in their life. Those who suffer from chronic and debilitating back problems frequently report feeling mentally as well as physically drained, often causing depression, missed time from work, and an inability to participate in day-to-day activities.
Most of the patients that come in have chronic, intractable back pain that requires some rehabilitation, physical therapy, short-term medications. And only a small percentage of those actually need surgery.
I got injured in 2003, and it basically stopped everything normal that I did. I was pretty active. I played volleyball weekly. I played golf maybe 10, 12 times a year. All that stopped.
Before the surgery, just with the laminectomy, I would have back spasms where I was on the couch for a week at a time getting Demerol shots, and my other boys, who were 7 and 10 at the time, were very embarrassed. You know, mom showing up with a walker or cane to their sporting events.
A normal part of the aging process involves the deterioration of tissues, especially those of the spine. As this happens, back and neck pain become common and are usually symptoms of an underlying spinal disease that can be safely and effectively treated.
When we talk about back pain with degenerative disc disease, the gold standard has been lumbar fusion. That involves putting in some bone and usually some hardware, screws and rods, to stabilize the bones in the lower back or the neck. Disc replacement is an artificial prosthesis that is placed within the disc space, which allows motion, bending, twisting, balance of the spine. And most of these patients can return back to almost normal activity.
Every year, millions of people elect to undergo major surgery to alleviate their back pain. But outdated insurance guidelines are denying many patients the means of successful medical and surgical treatments.
We kept applying and they were denying it.
I was denied treatment multiple times, and the doctor, went through all sorts of hoops and wrote letters and did all sorts of things, and still didn't matter.
Medical experts agree that surgical intervention should be approved based on what the physician deems to be necessary according to individual patient needs. As a result, healthcare professionals are working together to change the barriers set by insurance companies that limit the authorization of successful treatments and procedures.
The disc replacement is like a total knee or total hip, where you place a metal implant on both sides and a little plastic insert, and this allows motion forward, backward, side to side. In mainstream America, these large insurance companies have denied this device for their patients. We know that the cost of disc replacement is equal to fusion, but we think the long-term benefits are that patients will not have other surgeries. Therefore, they'll return back to work. They won't be taking as many days off because of their disability. And overall cost savings to the insurance companies, the government, and to the employer.
Dedicated to spinal care, Dr. Michael A. Kropf is a leading board-certified orthopedic surgeon who specializes in the treatment of cervical and lumbar disorders. Dr. Kropf has established a reputation for clinical excellence by contributing to major advances in the treatment of various spinal conditions.
My mission is to try to educate the population and patients who have back pain what their options are.
Dr. Kropf and his competent medical staff treat more than the source of your back pain by combining a unique multidisciplinary team approach, utilizing the world's most advanced technologies and procedures to manage the full spectrum of neurological care to help limit pain, speed recovery, and reduce hospital lengths of stay.
Back pain is managed by a whole team of physicians nowadays, stemming first from the family physician. Then there are physical therapists, pain management physicians, chiropractic, and finally, if they need to, the spine surgeon.
Specializing in the care of your spine and overall spine health, Dr. Kropf offers the best possible options for treatment of spinal ailments.
For me and for what I needed it to do, it's fantastic. I mean, I would do it a million times over. And I wish I had known about it years ago.
The year before, I decided I'm gonna do this mud run, and it was a 5K, and it was a military obstacle course. And all I had been doing is a spin class at the gym, thinking I'm gonna go run this course, and I did it. I finished it. So then I thought, well, I'm gonna go try another 5K. And it's just progressed where I've done probably 20 of them now in the last year. And it's just really changed, the whole surgery changed my life.
The care of your spinal health is important,